My name is Dr. Neha Kinsara. I am a double board certified child and adolescent and adult psychiatrist. My other certifications include infant psychiatry, which is ages 0 to 5, and my special super interest includes women's psychiatry and perinatal mental health, which is dealing with women when they are pregnant, in their perinatal period, post-pregnancy, and postpartum issues. So I have a patient who is now 31. She's been following me since she was 28 years old. She had really bad postpartum depression and anxiety with her first pregnancy. She was waking up with anxiety from her sleep, frequent panic attacks. And the second time when she got pregnant, she presented to me when she was 3 to 4 months postpartum, and she had this nerve-wracking anxiety coming out of nowhere. She had a lot of postpartum brain fog and fatigue. So she said, I'm going to finally get myself better. I need to get better for my family and for my kids, so I'm going to contact Amen Clinic. Her mom had her do that. She contacted Amen Clinic. We scanned her brain. We saw the classic diamond pattern. The diamond pattern talks about past emotional, unresolved, or current emotional trauma. The births of both her children had been very traumatic, and it was not traumatizing during pregnancy, but what she described was everything felt like it was coming to an end postpartum. The classic diamond pattern led us to establishing a diagnosis of PTSD of pregnancy or postpartum. And over a period of 2 years, we've come to the conclusion that alongside PTSD, she suffered with symptoms of depression, anxiety, and she actually developed postpartum ADHD. And we recently discovered through sleep study that she has sleep apnea. So there's like a classic cluster of symptoms that can start in a normally functioning individual in the postpartum period, which was so fascinating for me to look at her scans when we did that. And I have encouraged her to scan her brain again to see what that looks like. We have her on a regimen with lots of supplements involved. She's made great lifestyle changes. I've had several patients that have been super successful. This definitely kind of makes me feel very closely connected because I dealt with postpartum depression and anxiety, and my son was born during COVID when the world was shutting down and I had no help. And I didn't have help at the time, and my goal since then is to be, I have to help other women out there for this cause. So that is challenging yet rewarding because I see myself as a child, adolescent, and an adult psychiatrist, which means I'm a family psychiatrist. So I prefer and encourage patients to see me as a family together, because when there's a problem with one person in the family, there could be problems or issues stemming within the family system and dynamics themselves. It can be challenging because people have different personalities in the same family.